Dear students and my dear viewers, welcome back to Anatomy for Beginners. In this session, we are going to discuss about some clinically important positions of the body. Okay, there are variety of clinically important positions. So we are going to discuss their description of these positions and why these positions are adapted clinically. Okay, yes. In the previous session, we have discussed about the anatomical position, isn't it? Yes. The anatomical position of the body is imagined as the person is standing erect, both feet close parallel to each other and flat on the ground. The toes are directed forward, arms are hanging by the side of the trunk with the palms of the hand facing forwards, fingers facing straight downwards, head facing forwards, and eyes are fixed on a distant point. So these are the description of the anatomical position. Okay. And both in dissection of the cadaver or in the examination of a living individual or during radiological imaging, two other positions are frequently adapted. Those two positions are supine and prone positions. So these are the supine position, this one is supine position, and this position is called as prone position. Okay, now we will see the description of the supine position. A position where the individual will be lying down on his back. So here this person is lying down on his back on the table or a flat surface, whereas the upper limbs, okay, placed by the side of the trunk. If you see, the palms are facing up. Here you can see the palms are facing up and the person looking upward. This is called the supine position, and this position is adapted for dissection and also examination of the living individual, and it is used in radiological imaging also. The same use we can see in the prone position also, but the description is exactly opposite to the supine position for this prone position. Okay, how the person is here. The individual is lying down with the face. Okay, the person is lying down with the face, chest and the belly touching the surface. Upper limbs are on the side of the trunk. This is the prone position. Nowadays this prone position is used for COVID patients also to improve their respiratory capacity. Okay, now we'll move on to the next position called as a recumbent position. So here the recumbent position means the patient lying on one side, that may be right side or left side of the body, which is touching the surface. Here if you can see, this one is the right recumbent position. Here the patient or the person lying on the right side. So here this one is right hand. Okay, the person is lying on the right side with the right side body, touching the surface. The right side body touching the surface. Okay, whereas in the case of left recumbent position, the patient lying on one side, that is left side. Here this is the left hand, you can observe, left side with the left side body touching the surface. So this is the recumbent positions. Okay, so this is called as right recumbent position and left recumbent position. Okay, now. So such kind of positions we can give for the patients who are normally bedridden, okay, to prevent bed sores. Yes. Next one, we will move on to the next position, that is called as Trendline position. Okay, so in this position, how the patient is, this is the original Trendline position, this picture. So lying supine, so this is the supine position. The person is lying in supine position with feet higher than the head. So if you compare the feet is higher than the head is at this level and feet is at this level. That means if you can see this, the feet is higher than the head level by 15 to 30 degrees. This is the common position preferred for laparoscopic surgeries of lower abdomen and pelvis. So what will happen in this position? Here this is the abdomen. So the lower abdomen the abdomen was pushed downwards and the lower abdomen is very well exposed. So for that reason, this Trendline position is preferred for laparoscopic surgeries of lower abdomen and pelvis. Okay, if a person is having hypotension and shock, this position is adapted to increase blood flow to the brain. Hypotension means when a person is having low pressure. So when a person is lying on a bed and the person if suddenly raises from the bed, so what will happen? The pressure and the blood flow to the brain is decreased or dropped, we can say. So to prevent that, this position is also used. Okay, another one is the reverse Trendline position. So this position is, if you see the description of this position, the head is elevated. Higher 15 to 13 degrees in air. So here it is elevated 15 to 30 degrees in air. The patient is kept in this position to expose the prostate and upper abdominal region. So in this position, so the upper abdominal region can be exposed properly. Okay, this position is good for performing procedures in head and neck also. Okay, and this position also helps respiration for overweight and obese individuals during surgery by relieving the pressure on the head. But there is a risk of hypotension and hypothermia. So in this position, a constant monitoring is required for reverse Trendline position. Okay, next we will move on to the another clinically important position, that is called as Fowler's position. Okay, so it is a position sitting straight up, okay, or leaning backwards. This position is a leaning backwards position. So leaning backward, slightly backward position, or the person may be sit in the straight way also. Okay, so it is the standard patient position to relax tension of abdominal muscles, and this helps in improved breathing in immobile patients and for increasing the comfort during eating. So this is the use of Fowler's position. Now another important position, clinically important position, is the Science position. This position is used for rectal examination, therapies of rectal conditions, and for giving enemas. Okay, patients can lie for example, on the left side with left hip and lower extremity straight. So this one, so if the person is lying on the left side, okay, with left hip and lower extremity straight and right hip and right knee bent, okay, it is also called as lateral recumbent position. Okay, so if you take on the right side, exactly opposite is going to take place. So this position is mainly used for rectal examination, okay, and also therapies for rectal conditions and giving enemas. And we will move on to the next position called as lithotomy position. Okay, it is lying on back. Here you can see it is the position where the person or patient lying on the back with knees bent. Here you can see the knees bent and thighs apart. So normally in this position here the thighs are somewhat apart. Thighs apart. This is the position for vaginal examination and vaginal delivery of the fetus. Okay, so this is called as lithotomy position. It is lying on the back with knees bent and thighs apart. This is the position for vaginal examination and vaginal delivery of the fetus. Okay, so these are all the various positions of the body which are used for examination and for treatment purposes. Okay, and these positions are adapted in clinical practice also. Okay, yes, so we have discussed different kinds of clinically adapted positions. Okay, yes, in the next session we are going to discuss about the anatomical planes. Thank you.